I made this particular video talking about scientific ways that has been proven to help increase the length of the penis. And I got a lot of questions on the comment section, people asking about ways that they can fight erectile dysfunction, ways that they can deal with erectile dysfunction, and also ways on how to increase their penile length without surgery or medication. And this whole thing prompted this video I am going to make now. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 10 ways, 10 things you should take note of when it comes to penile length, when it comes to erectile dysfunction. Yes, but before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. This particular video is likely going to help you out with erectile dysfunction, but the third point is also going to help you out when it comes to increase in the penile length. Let's go straight into the first one, and that is speak with your doctor. You may want to ask, Nurse Miss Mary, why are you telling me to speak with a doctor when you said no medications and no surgery? Yes, it is important for you to speak with your doctor to rule out any underlying medical condition. Yes, because sometimes this erectile dysfunction may be as a result of some medical conditions such as diabetes, high blood pressure, multiple sclerosis, heart diseases, depression, and anxiety. So when you speak with the doctor, it is going to go a long way to know if this particular erectile dysfunction is caused by this medical condition. If it is caused by diabetes, your doctors will either place you on some insulin or some tablets to help with it. If it is caused by hypertension, your doctor might weigh the medication, some antihypertensive, and give it to you to help with it. So we have to speak with the doctor to ensure that there is no medical condition causing this erectile dysfunction. The second point I have to share with you is communicate with your partner. Yes, if there is no medical underlying condition, the reason why you could be having erectile dysfunction is because of emotional and psychological factor. Yes, if you are not sexually attracted to your partner or your partner is no longer attractive to you, that can make you develop erectile dysfunction. If you are anxious about sleeping with your partner, having sex with your partner, you feel your partner is far better than you, that can also affect your sexual performance. And also, if you've been having some post-traumatic stress disorder from previous sexual encounters, that can affect your sexual performance. So whatsoever the cause may be between you and your partner and you feel is not a medical condition, have a conversation. If you are no longer physically or sexually attracted to your partner, have a conversation. It could be the dress mode, it could be the way they're speaking to you. Just have a conversation and get it sorted out so that they can be sexually attracted to you and both parties can be sexually attracted to each other. If there are quarrels, there are misunderstandings, there are problems here and there in a marriage, getting erect might be difficult, and you may start feeling that you have erectile dysfunction, not knowing that the misunderstanding you both had, that is causing this whole erectile dysfunction. And if you're anxious having sex, that can be the reason why you're having erectile dysfunction. Now that takes us to the third point, which is likely going to help you increase the penile length and also help you with erectile dysfunction. Then the third point is exercise. Yes, exercise is very important when it comes to improving your penile length and also helping with erectile dysfunction. I was watching a video by Dr. Malik, a urologist, and I found out that she was analyzing a lot of research work that was done in regards to improving penile length as a result of aerobic exercise. Aerobic exercise, as the name implies, is simply that exercise that involves oxygen. Yes, it could be walking, it could be strolling, it could be jumping, but there's a particular exercise that helps with erectile dysfunction, that is beneficial to erectile dysfunction, and that is Kegel exercise. Yes, there are a lot of videos on the social media, there are a lot of videos on the internet that are talking about exercise, and they give you examples of Kegel exercise. So this Kegel exercise helps you to build your pelvic floor muscles. And the pelvic floor exercise are key to sustaining blood flow to the penis. Let's talk about a research that was done on 20,700 men of over 40 years. And guess what they found? Something similar, that exercise can help prevent erectile dysfunction, while lack of exercise can negatively affect erectile dysfunction. So what they are trying to let us know is that exercise increases blood flow to the penis as well as to the rest of the body. Research suggests people participate in 40 minutes of supervised aerobic exercise 4 times daily. So if you are not participating in exercise, it's advisable you participate in exercise. And if you are planning on increasing your penile length and things like that, please and please participate in exercise, exercise your pelvic floor muscles, and also I recommend you watch Dr. Malik's video, the urologist, on YouTube. Now that takes us to the fourth point which I want to share with you today. The fourth point I want to share with you is eat a nutritious diet. Yes, I'm going to be telling you the type of food you should take and you should not take. But first of all, I want to let you know that things that affect the heart is likely going to affect the penis. Things that affect your heart health is going to affect your penile health. Remember, when we talk about ejaculation, we are talking about blood flow. Right? We're talking about blood vessels to the penis. So there are things that put the heart at risk. They are likely going to put the penis at risk. Things like obesity, things like high blood pressure, they put your heart at risk. They also put your penile health at risk. You may want to ask, what food should I take and what food should I not take? What we advise you to take is to take a lot of fruits and vegetables. Yes, nuts, whole grains, legumes, olive oil, a moderate intake of fish, a moderate amount of alcohol, such as a glass of wine with a meal, a low intake of dairy and meat, and a low intake of candy. For the men that eat candy, we are advising you to have a low intake of candy. Then let me tell you what you should not take. In terms of the food you should not take, the first one I have to share with you is saturated fat, red and processed meats, refined flour, sugar, eggs, white fish, soda, a refined bread, pasta, and white rice. So these are the food you should not take as a man in regards to your penile health. I hope that is clear. Then that takes me to the fifth point which I want to share with you, and that is for you to limit your alcohol intake. Over times, I've talked about alcohol intake. I've talked about how alcohol is not good when it comes to your general well-being, your general body. Alcohol has this depressive effect on the central nervous system. And when the central nervous system is affected, the whole body is affected. I'm going to be making a video talking about whiskey dick in detail so you understand the effects of alcohol and erectile dysfunction. Then the sixth point I want to share with you is limit smoking. Over time, about my video about penile health, I've emphasized on the dangers or the effects of smoking too much on the penis, in the sense that smoking can affect the blood vessels, and we all know that when we talk about penile health, the blood vessels are very important. Then the seventh point I want to share with you is maintaining a healthy weight. Yes, being obese and overweight puts you at risk of erectile dysfunction. To maintain a healthy weight, it is advisable you exercise regularly and also take in nutritious diet, a well-balanced nutritious diet. Because when you are overweight, it puts you at risk of some other medical conditions that is likely going to put you at risk for erectile dysfunction. It can put you at risk for diabetes and also hypertension, and and that indirectly or directly affects erectile dysfunction. And there's a video I made about things that are likely going to increase or shrink the penile length, where I also emphasize on weight gain. You can also watch that video to get information about it. Then that takes me to the 8th point which I want to share with you. Then the 8th point I have to share with you is reduce stress level. Yes, you see people complaining, oh, my man comes back from work, he's tired, he's exhausted, he cannot do anything. And these men complaining, oh, recently I started developing erectile dysfunction. That can be as a result of stress. Yes, because stress releases a hormone known as cortisol. And this cortisol helps in the regulation of your blood pressure and does a lot of things. But when there's an increased level of cortisol in the body, that affects your testosterone level. And when the testosterone level is affected, it affects your libido and also affects your function. That is, it can put you at risk of erectile dysfunction. So as a man, it's advisable you manage your stress. Look for stress coping mechanisms that are going to help you out in managing your stress. And for the ladies, try to be understanding, especially when a man is stressed up, that the performance might not be the same when they are not stressed up, or when you were doing boyfriend and girlfriend and they have nothing to think about. But now they have a lot of things that is affecting their mind and that is stressing them out. Rather, it is important for you to try as much as possible, if you can, in any way you can, to help them manage their stress. Then the 9th point I have to share with you is sleep. Yes, there has been a research work that has linked sleep disorders with your testosterone productions. So sleep, if you're not getting enough sleep, you're not getting up to 8 hours, 7 hours, 10 hours sleep in a day, that might be the reason why you're battling with erectile dysfunction. So plan your day to ensure that you have enough sleep. Then the last point, which is the number 10 I have to share with you, is explore other form of sexual intimacy and sexual pleasure. It does not necessarily have to be penetrative sex. So there are other forms of sexual pleasure that can be explored for you and your partner to be happy. Let's put it that way. So these are the various points I have to share with you when it comes to erectile dysfunction and also improving penile length. While I tag this video the same way, because when you don't have erectile dysfunction, I believe penile length is not going to be an issue for you. So these are the various points I have to share with you today, and I hope it's beneficial. Kindly drop in the comment section if you have any question. I'll try my best to answer as much questions as I can. And if you have any recommendations, drop on the comment section. Please and please, this is a video giving you a general health talk. If you are concerned about anything, you can see the number 1 point: always speak with your doctor. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Bye, and see you in our next video.